WC stands for wheelchair. WC is wheelchair. Vertigo. Vertigo is the sensation of feeling just off, feeling like the room is spinning and you are super dizzy. So vertigo, dizziness, or feeling off balance. VS is vital signs. So VS, vital signs. Orthostatic hypotension. Orthostatic hypotension. It is also called postural hypotension. It is when you go from laying to sitting or from sitting to standing and you feel super dizzy and your blood pressure drops. So it is a measurable phenomenon. So orthostatic hypotension, your blood pressure drops. NKA or NKDA. Those are no known allergies or no known drug allergies. Cirrhosis. Cirrhosis is when there is scar tissue over healthy liver tissue. It stops the liver from working normally, and it's usually long-term chronic. And most common causes are hepatitis or viruses, alcohol abuse, and there's other medical problems that can cause it, but cirrhosis is when scar tissue replaces healthy liver tissue. Chronic. Chronic is an ongoing illness that's slow or gradual in onset. There is no known cure. The illness can be controlled and complications prevented with proper treatment. So chronic is an ongoing illness that is slow in onset. Empathy. Empathy is the ability to understand deeply and feel for another person's personal experience. Empathy. WBAT. WBAT stands for weight bearing as tolerated. Weight bearing as tolerated. WNL. WNL stands for within normal limits. HTN. HTN means hypertension, and that means that it's a condition that the person is typically, their blood pressure is high. So hyper, it's up. So it's a long-term medical condition in which the blood pressure in the arteries is persistently elevated. HTN, hypertension. LOC, or the triangle with LOC, if you see that, that means level of consciousness, and the triangle means change. So if you see that, that's change of level of consciousness. Side note, LOC can also mean loss of consciousness. But in this case, we're talking about level of consciousness. Apnea. Apnea is the absence of breathing, or slowed or stopped breathing. So like if you have sleep apnea, there's an obstruction that happens when you are breathing. So apnea, the absence of breathing for some reason. Integumentary system. Integumentary system. So that's basically the skin. It is the largest organ of the body that forms a barrier between the outer and inner environment. It's the protective layer for your organs and bones and all that stuff. So your the integumentary system is the skin. Edema. Edema is swelling. You usually see it in arms or legs. It is puffiness. It is excessive fluids trapped in the body's tissues. So edema is swelling. Emesis. Emesis is vomit. In the hospitals, they have those little U-shaped bowls that are like pink. Those are called emesis basins. So emesis is vomit. Flatulence or flatus is gas. Flatulence, it is gas. DVT stands for deep vein thrombosis, and it's a medical condition that occurs when a blood clot forms in a deep vein. The clots usually develop in the lower leg, thigh, pelvis, and they can also occur in the arms. So DVT stands for deep vein thrombosis. DNR. A DNR is do not resuscitate. It is a order. DNR is an order. It's a request to not have CPR performed if your heart stops or if you stop breathing. Dialysis. Dialysis is a procedure to remove waste products and excessive fluid from the blood when the kidneys stop working properly. So it's a treatment for people whose kidneys are failing. Dialysis. Defecation. Defecation is the moving of bowels, so movement of feces. It is going to the bathroom. Number 2, defecation is having a bowel movement. Delirium. Delirium is confusion. It is a decline from the previous baseline mental functioning that occurs in a short period of time. It encompasses disturbances in attention, consciousness, and cognition. So it's an acute confusional state. Delirium, confusion. Disoriented. Disoriented is an altered mental state. The person who's disoriented may not know their location and identity or the time and date. It's often accompanied with other symptoms such as confusion or being unable to think with your normal level of clarity. So disoriented is an altered mental state. In confusion, unable to think with normal level of clarity. Disoriented. SNF, or SNF. SNF stands for Skilled Nursing Facility. SOB. SOB is shortness of breath. Self-actualization. Self-actualization is to realize fully your potential, knowing what you're capable of and what your limits are. It's the process of becoming everything that you're capable of becoming and knowing what your limits are. Self-actualization. Reaching your full potential and knowing what your possibilities are. TF. TF stands for tube feeding. Terminal. Terminal is an illness or an injury from which the person will not likely recover. Terminal. Impaction. Impaction is a lodgement or an instance of a lodgement or something in the body passage or cavity, blocking the cavities. So it is a mass or a lodgement blocking body passages. Impaction. So most commonly, like fecal impaction is bowel or a material blocking that canal. So impaction is a mass or lodgement blocking a body passage. Incontinence. Incontinence is the inability to control your bowel or bladder. It's involuntary, so it's an involuntary loss of bowel and bladder control. Incontinence. Perennial care. Perennial care. It is washing or cleaning the genitals and the rectal areas of the body. It should be done at least once a day during bed bath, shower, tub bath. It's done more often when a patient is incontinent. This prevents infection, odor, and skin irritation. So perennial care is the cleaning of the genitals and rectal area of the body. Paraphrasing. Paraphrasing is to use different words to express the same idea or meaning. So to use your own words without changing the meaning. Paraphrasing, to put things into your own words. Parenteral nutrition. So parenteral nutrition is feeding of nutritional products to a person intravenously, bypassing the usual process of eating and digestion. The products are made by pharmaceutical compounding companies, so to prevent malnutrition. Parenteral nutrition, so IV nutrition. GERD, G-E-R-D, GERD. GERD is gastroesophageal reflux disease. It is chronic heartburn, acid reflux. GERD, gastroesophageal reflux disease. It's pretty much really big heartburn. Ad lib. Ad lib is a Latin one, and it literally translates to in accordance with one's wishes. We use it at one's will, so it pretty much means the performer or the person is free to do whatever they like for as long as they desire. So another translation is at one's pleasure. So it's not as needed, it's as much as they want. Ad lib. As they like. Q2H is every 2 hours. Q6H is every 6 hours. QOD is every other day. RO. RO. There's actually a ton of RO medical definitions, but this one is rule out. Rule out. So you are narrowing down what they do not have wrong with them. So RO is for rule out. Emphysema. Emphysema. A disorder affecting the alveoli of the lungs. The transfer of oxygen and carbon dioxide in the lungs takes place in the walls of the alveoli. In emphysema, the alveoli become abnormally inflated, damaging their walls and making it harder to breathe. So emphysema is swollen alveoli. Alveoli. Alveoli are the tiny little air sacs that are in the lungs. They're like little balls. So alveoli. Tiny air sacs in the lungs. Aspiration. Aspiration is the accidental breathing in of food or fluid into the lungs. Aspiration. So you've aspirated some fluids into your lungs. ALR. ALR is assisted living residence. DON. The DON is the Director of Nursing. RN. The RN is a registered nurse. LVN. An LVN is a licensed vocational nurse. LPN. LPN is licensed practical nurse. CNA. A CNA is a certified nursing assistant. Rehabilitation. Rehabilitation is helping others to return to their highest physical and mental abilities. Rehabilitation. Respite. Respite literally means a period of rest or relief. So, providing a caregiver temporary relief from responsibilities of caring for persons with chronic physical or mental disabilities. So it's like a little vacation for the full-time caregiver. A respite. Caregiver relief. RUQ, RLQ, LUQ, LLQ. So RUQ is right upper quadrant, RLQ is right lower quadrant, LUQ is left upper quadrant, LLQ is left lower quadrant, and it's referring to the quadrants of your body. Prosthesis. Prosthesis is a device, such as an artificial leg, that replaces a part of the body. Prosthesis. Pronation. Pronation is rotation of the forearm and hand so that the palm is facing down. Pronation. Supination. Supination. Supination is rotation of the forearm and hand so that the palm faces forward and upward. So the opposite of pronation. Supination, to face the palm upward. ROM. ROM stands for range of motion. So when you see an arrow pointing up, that would mean increase range of motion. Range of motion. CRF and ARF. Chronic renal failure and acute renal failure. LLE and RLE. LLE stands for left lower extremity, and RLE stands for right lower extremity. OBRA. 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 It's the Omnibus Budget Reconciliation Act of 1987. OBRA. The Omnibus Budget Reconciliation Act of 1987, which is also a federal law. Abandonment. Abandonment is considered a breach of duty. It is disengaging or not giving adequate notice to obtain a substitute for care. So not showing up for your shift is also abandonment.